This is Klean Radio.
Welcome everybody out there listening on KFWB News Talk 980, our flagship station, or Extreme Talk XM channel 165, or the World Wide Web at cleanradio.com. I'd like to say hi to everybody out there listening and that listens every week. We have an awesome show for you tonight. In the studio, we have the Energy Whisperer. That's Erica Spiegelman with me.
Hi, how are you?
I'm divine. How are you?
I'm doing wonderful.
Yeah?
Yeah, Energy Whisperer.
Yeah.
We just came up with that name for me.
Yeah, that's your tag.
Because I'm very intuitive, and I feel like when I meet people right away, I kind of pick up on their energy.
So you think people that are intuitive, that's where it comes from?
I do.
Oh.
I think it's an innate thing. I mean, either you're intuitive or not. You get a good energy, reading from someone. Are they a good person? Do they seem like they're helpful? Treat people with respect. Treat themselves with respect. So Can't you pick up on that or not?
I do, yes.
Yeah.
I know people right away, usually.
Yeah.
Occasionally I'm wrong.
Do you think that is because we're both sober? Mm-hmm. Do you think that it's maybe because we're so present that we kind of don't have anything else distracting us, like alcohol?
I think even since I'm a kid, I've always had that, ability to pick up on people. I don't know what it is.
I think so too, yeah.
I mean, I could think of a couple things. I don't think anybody out there listening really wants to hear
how intuitive you are?
Yes. I don't know.
But I think it's a good point because I think people have to begin to honor like their inner voice.
Yeah.
And if
I think that's very important. That's actually a great point. What you're talking about is because when you are sober, in the beginning you do have to take direction.
Yeah.
And constantly you're asking questions, but at a certain point you really have to learn to trust what your
gut tells you.
What your gut tells you, right.
Exactly. And a lot of people that are especially drinking, using drugs, they get involved in relationships where they know maybe that person's not so good or that person uses drugs and they go against what they feel in their heart and their mind takes over. And that's,
No, I mean, I you're right. I mean, but more importantly, I have to ask this question. I have to ask this question to the people out there that are listening.
Yeah.
I had a funny discussion with Rand outside, and he was joking. I had to go to the bathroom. He said, "Why don't you go here?" And I said, "Because I'm wearing button-up jeans." Mm-hmm. And I said, "Who even buys button-up jeans anymore?" And I realized I don't try my jeans on. I'm a 3330, right?
Okay.
So if anybody out there wants to buy me jeans.
Good to know. I'll note that for Christmas.
I'm 3330. It's very easy to shop for me. And so I don't actually ever try on pants. Okay, so I just pick up the 3330, then I get home and I see their button up, and that's when you have to make the decision.
Oh, that's funny.
Right, it's not like the straight leg or the slim leg. That goes back to the store automatically.
For a man, it's all about the button up or the zip, right?
Yeah, I don't get button up. It's like you've created a zipper. Why go back to button ups?
Old Levi's were button ups, but we can.
Yeah. Anyways, we digress. Let's wish everybody out there happy holidays.
Yeah, happy Thanksgiving. Happy Thanksgiving. Mm-hmm.
Yeah, and I think one of the things we want to talk about a little bit tonight is tricks for staying sober on Thanksgiving.
Yeah, I mean, it's the beginning of the holiday season. Yeah. So from this point forward, we have Christmas parties, Thanksgiving, holiday dinners, a lot of, events. A lot of people have a lot of work things going on. And my clients, especially right now, it's a really triggering kind of time of the year. And we really try to present to them ways in which to stay safe. So
what are a couple of the things you teach them?
Always get your own ride or take your own car to parties so that you're able to leave whenever you want. Don't ever get stuck somewhere. And especially if you're newly sober, if someone says, I'll come pick you up, say, thank you. I'll meet you there. Tell the host that you're going to be staying just for an hour so that you're not stuck. Mm-hmm. Kind of take some precautions so that you really feel like you could get out of there if you need to.
And what about for people? Because this is a big thing, is people, their biggest triggers can be their family.
Yeah, of course.
So a lot of people are very scared about, they're sober. They don't want to go home because so much drama goes on there.
Right.
Whether it's not even that has to be drinking, there's just, those are the triggers.
The behaviors of everyone, yeah.
So what are some suggestions you say to people?
Well, I usually tell people to kind of have the boundaries before they go into the situation. So if you know that you're kind of you're not communicating properly with someone in your family, try to talk to them before you get in a situation where there's, a lot of frustration around you or your anxiety feels high. Take someone with you. I always say that to people. Take a friend to the dinner. It kind of acts as a buffer.
Right. I don't know if I want to bring anybody back.
No, but listen, I mean, it actually does work.
Yeah. And I think something you're also saying
take
that's
a
very
sober
important
friend.
is being honest.
Yeah.
is, I think sometimes people are really scared to say to their family members, when I was getting sober, my mother was really cool. She's like, she didn't want, she's like, do you want wine at the Passover Seder? Is it okay with you?
Are you going to be comfortable?
Right. Are you going to be comfortable? And
Right.
we had those discussions. It's okay to have these discussions.
Absolutely, but that's wonderful that she was actually open enough to have it. So some people are in denial. Most
Right.
family members are, they don't want to talk about it. They don't want to rub their kids the wrong way. So, it's good. It's good that your mother is so supportive.
I'm blessed.
I'm blessed too. My mother was so supportive. So supportive. Yeah.
And to all the people out there, you're listening to Klean Radio. Give us a call at 888-539-2980. That's 888-539-2980. I'm in the studio tonight with my guest co-host, Erica, the Energy Whisperer Spiegelman. Give us a call again. The number is 888-539-2980. One of the cool things about this show is that we have a wide variety of topics and people that come into the studio. And you're a therapist, Erica.
Yeah.
You work with tons of people. One of the huge issues for girls and guys a lot is eating disorders.
Yeah.
It's a tremendous thing.
Oh, yeah.
And I know somebody that
It's an epidemic, I think.
it's horrible. And I know somebody that's actually bulimic. That was bulimic. And they were bulimic for about 20 years.
Yeah.
And they said to me, the only person that knew was their dentist. That was the only person that knew for 20 years that they were bulimic.
Right.
And I found that I was like, since they told me that, I've actually really been fascinated by this topic. But I think it's so many more things. I think dentists know a lot of things. They see people come in with meth, with coke.
Right.
People don't realize cocaine does a really crazy job to your teeth.
Well, they see all the signs from the damage, and you could hide that obviously from let's say your mother or father
Or a doctor.
Yeah, I mean, I'm sure we have these wonderful ladies on tonight.
Yes.
But I'm sure they'll discuss further how that you could tell from erosion and all the other things.
Yeah, and let's welcome.
Hi.
That's a great segue to our guest. They're from coastlinesmiles.com. We have Dr. Sanda. Did I pronounce it correctly?
Dr. Sanda from Coast to Coast
Coast
Smiles.
to Coast. Coast to Coast. I'm sorry.
Because we practice in LA and New York.
So it's Coast to Coast. There was actually one of my favorite radio shows of all time is called Coast to Coast.
Really?
Yes, and it's about aliens and stuff. Not that I believe in it, but I just enjoy listening to the people calling in. And also sitting next to her is Dr. Olga.
Yes.
And you guys come a little closer to the microphones. Well, welcome from Coast to Coast.
Welcome.
Thank you
Thank
very
you.
much.
Nice to meet
Welcome
you.
to Klean
nice to be
Radio.
here.
Yeah.
Wow, nice to be here.
And so we're talking a little bit about that. Has that occurred in your practice? First, before we start, what do you guys do?
So I'm a periodontist and nutritionist.
Okay.
Oh, good.
So I
Both sides.
as a periodontist, I treat the foundation around the teeth. I look at the gums and the health of somebody's mouth and overall health. You could see in the gums, actually.
I'm going to keep my mouth closed all night.
I'm gonna be shining
Yeah,
bright.
you're going to be shining. I'm like this.
Just kidding.
Beautiful smiles.
Yeah,
here
she
all
does.
around.
Yeah.
You have a good smile.
Yeah, I have a good smile. So I have about 50 grand in my mouth. And still all my natural teeth. Anyways, let's get back. So you're a nutritionist, a periodontist.
And I do dental implants as part of that specialty, as well as making sure that patients heal well after my procedures. That's where the nutrition part comes in.
Okay, and
Interesting.
So, and I'm a prosthodontist, so I work with Dr. Moldovan. She does the surgery, and I put the teeth over the implants that she places.
I might
actually
need to be
restore the
seeing you guys.
smiles.
I'm actually not joking. On November 28th, I'm having one of those things put in.
What?
Dental implant.
The dental
I
implant.
like how you do this.
And
the movement.
I don't.
They're
I
like
was
reading your
actually-
mind.
Can I tell you something? I was actually at his office and he's showing me all the stuff, and I'm like, please don't show me. Okay, I don't want to see the metal screw that's going in, but which raises an interesting thing because it's a painful procedure. It can be a painful procedure.
What is it exactly for
Yeah.
the people that don't know what
Yeah.
you're really talking
Well,
about?
surprisingly, it's not that painful anymore.
Okay.
So nothing to be afraid of. For example, my mom, I placed 4 implants, and then she took a couple of Advils, and we went shopping the same day.
Oh.
Okay.
So it's not what it used to be.
Can I get your mom's number?
Sure.
So I could talk to her? Yeah.
We've had a patient who did full mouth rehabilitation, upper and lower, full implants with new teeth, and she had no pain. She had took just Advil.
So you're, which is amazing.
Yeah.
So you're basically seeing people, and you're saying, okay, so they're coming into you with the end, right? Something has gone askew in their mouth,
Yeah.
Right.
and the next thing is you're trying to figure out how nothing else goes askew in their mouth.
Is it that, or is it more like a rebirth of a new set of teeth?
It's pretty much a rebirth of a new set of teeth.
Listen to
absolutely.
her. She's
So they get a third set of teeth with the
Okay, good.
implants.
Yeah.
and
For
with
other
the-
people that don't
yeah.
understand, that's really what it is.
You
Right?
should be our
Okay.
manager. I like
Yeah, she is the energy whisperer. And if you just tuned in, you're not listening to Dental Talk with Klean. You're listening to Klean Radio, a show about addiction and recovery. But one of the things I've noticed is when I got sober, I had 18 cavities because I had neglected my teeth. And it was literally the summer of dentistry, my first first
gosh.
sober summer. And
Wow.
do you, I mean, like, obviously, I'm sure you've seen people come in with all types of things, with addiction or, are you able to tell from looking at their mouth?
Absolutely. A lot of times we can tell from just looking at their mouth.
And we
Yeah.
could tell whether or not they have bulimia or, they have an alcohol problem or what is the acidity of their mouth. Because really that's what destroys tooth surfaces.
It's the enamel.
Right, the enamel,
Yes. It's acid in their mouth. And that could come from food or could come from their own saliva. If that becomes acidic, then it really destroys the tooth surface.
Wow.
And
wow.
have you ever had to have that conversation?
Yeah, do you have that conversation, or is it too personal?
No, and I think it's a matter of how we approach patients, and they have to feel comfortable to
Right.
talk to us about that because it's really
To admit it,
a lot
too.
of them are ashamed.
Right.
They don't want to share. These
I mean,
things
teeth
with us.
are an amazing thing. I mean, teeth are your teeth. And,
Teeth are your
I mean,
teeth.
I didn't have anything profound on that one, but there's something very shameful you have. I think I remember I was in so much pain, but I was so embarrassed about the way my teeth looked that I didn't want to go to the dentist because I didn't want the dentist to see what I had done to
Right.
my teeth. So I was perpetuating this
Cycle, the cycle.
this cycle of just not getting help.
That's true.
And one of the things I tell people when they get sober, and if they're in pain, any type of pain, I'm like, go to the dentist,
Yeah.
because it doesn't get better.
Right.
Exactly.
I just did a group at Klean on this
Yeah.
actually about procrastination, and one of the biggest things that came up with the procrastination is getting your teeth checked and going to doctor's appointments. I mean, across the board. So a lot of people that are suffering for years of just neglect, whether that's from drinking or using drugs, their health comes last because they do not want to hear if there's something wrong, because then they would have to stop using the substances. So they avoid that at all costs. So it's
Absolutely.
interesting.
Well, the amazing part, we're actually seeing inside somebody's body. I think
Yeah.
that's why it's such a personal and intimate relationship we establish with the patient. And when I look at somebody's mouth, I really see a story. It's not just their
Just
teeth.
don't look at my mouth, because that's a hell of a story.
Tell us, I want to
Yeah,
hear.
go.
Yeah.
Yeah, that's
What,
the way
what
we
kind
look
of
at
like
it.
what kind of thing have you picked up on recently? Like, for example, what's
You're the energy whisperer, they're the teeth whisperer.
yeah, that's good.
Yeah. So, for example, I've had a young patient. She came in with very eroded tooth surfaces on the top surface of their teeth.
Yeah.
So that could be somebody that has, for example, they take sodas and they swish their mouth with sodas. So I start asking them about, their lifestyle, what do they eat or
Right.
drink, to figure out what exactly is causing that. And I try to help them change that.
That's great.
Yeah.
I mean, it's like sort of, you're right. It's you guys see everything with the mouth. You can see people's health. You can see what they're doing right, what they're not doing correctly. Why do people have such a fear of the dentist?
I think it's just a bad stereotype from
Yeah.
a long time ago, because right now we have a lot of techniques that we can utilize to actually make the treatment much less painful. And also we do a lot of procedures in one major appointment.
Right.
And after that, a lot of procedures are just, a lot of times don't even require anesthetic. So a lot of people they think it's going to be like a long process, then they have to go to a dentist every 2 weeks, and every time it's a lot of pain and discomfort.
like
But
you
it's
said.
actually
Yeah.
not like that anymore.
But do you think it also has to do with, by the way, we're in the studio tonight with two amazing periodontists, nutritionist, and Dr. Sanda and Dr. Olga,
I'm a prosthodontist.
a prosthodontist, which I'm definitely going to get confused tonight. And
It's okay.
from coast to coast, and also my special guest host is Erica, the energy whisperer Spiegelman. And we're talking about, dentistry and all this stuff that I think, but you guys seem really cool. You guys seem really nice. And I'm not just saying that because you're in the studio in front of me. But do you think that has a lot to do with, people being scared of the dentist? Is dentists aren't always known for being sweet.
Yeah, you're right.
And that's something I look for in a doctor. I look for somebody that when I almost walk into their office,
They want to hug you.
They want to hug me. They're going to hold my hand and say it's going to be okay, because I'm terrified.
You want to be babied.
I do. I mean, I had to have a wisdom tooth out when I was about 13 years old, and they came to me with this big needle that they were going to stick in my arm and pass me out, make me pass out. I ran out of the office. I left the office.
Right.
My mother, chases me down, and I'm like, I'm not going back. And I didn't go back, and I think people, especially addicts and alcoholics, have this fear, right, Erica? I mean, of pain.
Well, I think they just have a fear overall of actually taking care of the damage of their past, and whether that means physically. Right? So like whether that means their teeth or that they have to apologize to somebody for saying something nasty. I mean, I think that's why in many ways people that struggle with substance abuse, whatever that may be, or, bulimia or just the consuming of whatever it is, that they really, it's hard for them to clean up everything and clean up all parts of their lives. Yeah.
And, I can relate to that fear of the dentist because I grew up in Romania. So we had no dental anesthetic. I moved here when I was 14 years old. Yes. So I do not really enjoy sitting in the chair to be a patient because automatically I think of the days when I had to sit in the chair and I was in pain.
Right. So
I think for anyone, if they've had a bad experience, that stays with us a lifetime.
That's true.
And I forgot to give it the call-out number. It's call-in number. A call-out would be different. And it's 888-539-2980. That's 888-539-2980. Give us a call tonight about anything you want to talk about. But let's talk about what does a bulimic mouth look like. And I don't,
So there are really distinct signs of bulimia. You can actually see there is an erosion, which is very much visible on the inside of the upper front teeth. Because if someone is vomiting, that's the area that the acid from the stomach hits. And also you can see destruction of the enamel on the back teeth. So the length of the teeth gets smaller, so then the whole bite kind of collapses. And so the lower front teeth are actually not affected. And also you can see people who are affected by bulimia, they also have parotid glands that's somewhat swollen.
Right.
So that's
what's interesting is that, if a young woman or if a woman in general, let's just say a woman, because I think the majority of people that are bulimic are women. I know there's men also that suffer from that too. But let's say it's kind of like a cry for help, and you actually say something to them and they say to you, can you help me now that, because you are a nutritionist. Has that happened before? I mean, that must be so rewarding for you to kind of be the catalyst, the person that helps them. It's kind of like us with people that are substance abuse. Like if somebody really wants to reach out for help, I'm sure they would feel more comfortable with you.
Yes, especially with the young girls. I've had a patient that I could think of. She was 18 years old.
Yeah.
And I could tell immediately by looking inside her mouth that she was bulimic because of what Dr. Olga was just mentioning. And that's something that only the dentist could see.
Right.
And, I was probably the only person that knew this about her.
And did you have a conversation with her?
I did. I asked her, I said, are your teeth sensitive? I said, you're missing some tooth structure on the back of their teeth.
And she's 18 years old.
Yes. And she was a little bit fearful in the beginning, and she didn't want to open up very much. And then I just talked to her about nutrition in general and about life, and just try to, because I really cared about her. I wanted her to get better. So she felt safer.
Yeah, that's what I mean. I would think that she would feel alone, and you're the only one that kind of knows. So I think just, naturally that would be, you would be the person for her to reach out to.
Yeah. So I tried to find her a support group.
That's so nice.
Oh, that's amazing.
So,
and have you seen other people, obviously, the reason I think this is really important is because when people are in addiction, they don't realize the damage they're doing. They could be in this amazing amount of denial, still thinking they look great. Now, a perfect example is if you look at pictures of Charlie Sheen's mouth. Doesn't look great. The guy's done a lot of, from cocaine. I mean, and
crack,
or
crack. Yeah.
But also when people use cocaine, right, they put it on their gums, right? It supposedly gets. I've never done. Supposedly it brings a high. I'm not looking at it. You guys.
I read about this.
Yeah.
I read about this, and we actually could see sores in the mouth because cocaine being so acidic, it causes sores.
And meth. I mean, I see people that come in all the time that have been smoking meth or doing, using meth, and because of the chemicals that are in meth, which is really poison,
Right.
their teeth are completely eroded. I mean, they're gone.
So the question is, how are we going to get people out there that are listening? And we have a lot of people listening right now. How are we going to get people to you? And I know that obviously I'm not just saying going to coast, your website, which we'll give out in a little bit, but how is it, like a guy like me that was terrified, how do we create a way? You saw that show, Jamie Oliver's Food Revolution, and I couldn't believe I actually watched this thing, but I got caught up in it because he has this excitement. How do we get you out there on the streets in a good way, helping people? And I mean that. What is the trick to grabbing people and saying, you need help?
Yeah, that's a tough one because and what Dr. Olga and I are trying to do is really work with the rehab centers and to get the word out with newspapers, with television, to really get the word out that we can help you start a new life and have a beautiful set of teeth so you could be out there in the society and not be judged.
Yeah.
Right.
The self-esteem thing is really going to help these.
And also, we're not there to judge. We're there to help.
Well, I think that's part of the problem, too, is that, people that have done this to themselves through neglect, through whatever it is, they feel shame. That's a shame-based. And I know in my case, it was extremely, I was like, how could I have let this happen to myself?
You said that about a lot of things that time.
But you're right. But the problem is I've done it over and over again. I wish I could say when I got sober and I had the 18 cavities done, but I constantly, because I think a lot of it also has to do with depression, when you feel like, and which I've suffered through bouts of in sobriety, when I felt like, oh, nothing was worth it. So I would,
It comes down to, I really do think this too, self-love. And it's about building compassion for yourself. I say this all the time. And it's, to treat yourself right would be to go to the dentist. To treat yourself right and with love would be to take care of pain and problems before it comes to the point where you have to now get rid of all your teeth. I mean, there's a certain kind of, I think, self-nurturing that we have to begin to spread. That's what you need to spread, really.
Yeah, I mean, you're right. I mean, for the past year, I'm going to brag, I have not missed a night of flossing, night of brushing my teeth twice a day, doing the circles around my teeth, and I'm so proud of myself. I haven't missed, and I think you're right. It's about self-love. It's about all of those.
And what about your esteem? Let me ask you.
My esteem is great. I'm a flosser.
But don't you think you feel like even on a even like on an unconscious level, you feel better about yourself when you do take care of yourself?
Yes, I do. And as hard as people do. You're right, but it's for addicts and alcoholics. And a lot of people, I don't want to just say addicts and alcoholics because we look at children running around. There's the esteem that so many heavy kids running around out there. And, but you're right. I mean, taking that first step, which is calling the doctor, and actually taking care of yourself sometimes is the hardest. It's making that step.
I feel good. I pat myself on the back when I take care of something like that.
Yeah.
I do. So that's what you need to do in order to build that kind of self-love.
And I think what people need to realize, sometimes we get patients at coast to coast and they say, well, I'm so sorry I did this to my mouth. But I actually, when I look at this patient, I'm not judging the patient. I'm saying, I'm thinking that's great. He or she is taking care of themselves. There's no reason to apologize.
Maybe we should put a sign on your door that says we do not judge.
Or there's no reason to apologize.
We got nothing but love in this office.
It's true.
Absolutely.
And I think you're right. I mean, I think that's a huge fear. I mean, everything you're saying is reasons I had this terrible thing of, I was like, they're going to judge me. The dentist is going to see my mouth and look at me and go, what's wrong with you, man? And I was embarrassed.
Yeah.
And it's about getting that stigma away.
Yeah, and the thing is, some things we don't know. Like, for example, when I lived in Romania, I didn't know anything about floss.
Right.
We didn't have floss. So I came here. I had a bunch of cavities. We used nothing. We didn't even know you're supposed to clean between the teeth.
Right.
So
it's education then too.
Yes, it's education. So
So maybe we should start educating people more and more in the treatment centers about how important it is. And from what I've heard and read recently, since I knew you were coming on here, that really your health is it's really all in your mouth. I mean, everything, if something should go wrong or you get an infection in your mouth, it could spread all throughout your body and be really serious and dangerous.
Absolutely, like a dental abscess.
I don't think people know that.
Yeah.
Yeah, dental abscesses can actually cause brain abscesses,
Right.
or it could cause swelling of the throat to the point where you can't breathe.
This is
So
good times.
Yeah.
But I actually knew, you're right. A lot of people don't know this. A lot of people don't know if you
don't
neglect
know.
your tooth, you could get something in your heart attacks.
Yeah.
yeah,
That's-
The
there's
heart, the brain, it's all connected.
That's what I was. By the way, if you just tuned in, you're listening to Klean Radio. That's Klean with a K. The number here is 888-539-2980. That's 888-539-2980. A lot is going on this Sunday night outside of Klean Radio. You got a lot of different things going on, but yeah.
Yeah. We have the discussion about your
Yeah.
health. We have Thanksgiving coming up. We have safety plans to
Yeah.
talk about, educating people on how to take care of, their health in good ways and stop procrastinating.
And in the studio tonight, we have with us from Coast to Coast Dentistry, and they wrote it wrong for me, so I'm really sorry about that.
No
Blame
problem.
it on them. And from there, we have Dr. Sanda and Dr. Olga. And okay, so one of the things I want to do tonight is I want to get people in to see you, not because I'm getting paid to do it, because I actually think you guys are really nice. I actually might go to see you
Thank you.
myself. I might cancel my doctor's appointment
I might
on
too.
November 20 on,
Nice to
November,
see you.
on November 28th and go to see you guys if you take my insurance.
Awesome, of
do you guys
course.
take insurance?
We do take insurances.
You
and-
paused for a second. I'm a little no. I'm sorry.
No, we definitely take
Oh my God.
insurances. And now actually medical insurances are starting to pay
Oh,
for
that's
dental
great.
reconstruction,
Yeah.
especially for someone who has some type of a systemic condition, which addiction is.
Yeah.
And it's a reconstruction of the mouth, and actually medical insurance is starting to pick up the tab, which is
That's
really
great
good.
to know. actually.
So one of the things I think is amazing is a lot of people have a fear too. I mean, I don't know if they're telling the truth when they say this, but there's a lot of pain. A lot of drug addicts have issues with taking pain medicine. There are substitutes, right?
That's a great topic,
Yes.
actually. Not only the dental procedures are less invasive today, we
Yeah.
practice what is called minimally invasive procedures.
Right.
But there's so many different ways to kill pain
Yeah.
or to get rid of it, not just through medication.
Yeah.
We use acupuncture, for example. We use a low-level laser therapy, which has worked
Wow.
great for pain, and it's been used for about 40 years in Europe and Australia.
That's amazing.
And then we also I use a lot of nutritional supplements for that, and anti-inflammatories, like quercetin, which is an onion extract, which is anti-inflammatory.
Do you have bad breath after? Bad joke.
Yeah, or bromelain, papaya, or pineapple enzymes.
Okay, we'll talk about that more after the break. We're going to talk about pain meds after you go to the doctor, essentially.
Good subject.
The discussion continues at cleanradio.com. Give us a call at 888-539-2980. That's 888-539-2980. We'll talk to you in a few.
Are you struggling with an addiction that's ruining your life? Want to have a confidential conversation with a professional that will immediately assist you? Do you suspect a loved one is abusing drugs and would like a free drug testing kit and consultation? Clean Treatment Center is standing by right now to help those with addictions and the people who care about them. Call 888-601-6040. That's 888-601-6040. Or go to Clean Treatment Center, that's clean with a K, cleantreatmentcenter.com. Addiction happens. Recovery and a new life starts here.
Welcome back to Clean Radio. We have an amazing show going on tonight. I'm actually really happy these two guests are in the studio tonight. They're from Coast to Coast Dentistry. It's Dr. Sanda and Dr. Olga.
It's very smiley in here. I
Yeah,
like
it is. It's
They're smiley
where,
women.
Where you guys got to stick a little closer to the microphones. But I'd like to welcome you back to Clean Radio, along with my guest co-host tonight, Erica, the energy whisperer,
Yes.
Spiegelman, and you guys are the
Whisperer.
teeth whisperers.
Great to be here.
I mean, I think Kathy, who's your publicist, is outside. I think she should really go and get that name for you right now. Like, go online and just get the dentist.
Patent it, copyright
Yeah,
it.
get because you know what, you guys. I think Dr. Katz, if you're out there listening tonight, I think I might have found a new dentist.
Oh,
Yeah.
He's got competition.
But one of the
You're
things
going to fire him on air?
I'm gonna get fired. And one of the things, no, he's actually great. But there's so many
I
Dr.
know.
Katz's. It's not like anybody's gonna know which one I'm referring to.
I just hard time.
I could say that. But we're in the studio tonight. We were talking before the break about pain meds, and so many people I've spoken to, that are sober
So great. Such a good subject.
are terrified or go out when they go to, when they get a lot of. I know people that have gone to get dentistry work so they could get high.
Oh,
And
definitely.
what do you guys? I mean, there are. I mean, because a lot of time. I mean, we live in Los Angeles. The show goes all across America and to England, and all over, obviously, since we're on the web. But one of the things is, have you had people come in to try to get drugs?
Absolutely. And they're usually very specific about what they want. So
Right.
when someone says, well, this thing doesn't work, but this thing is really good for me,
Right.
then
Right.
kind of the red flag goes on. So
Yeah, I had a
that-
patient
yeah.
that I recently treated actually with dental implants, and he got his prosthesis. Everything looks great. Every 2 weeks he comes in. There's a little sore on my gum, and I want OxyContin and
no.
30 tablets
Wow.
for a little. So we keep adjusting things. He keeps coming in. I said, okay, you cannot get 30 tablets of OxyContin.
He's
like,
drug seeking. Yeah.
yes.
And then he said,
Yeah.
"You're no longer my dentist."
To
Have
the
you
next one. That's
have
what
you
they
seen
do.
him again? That person?
I have seen him again, and actually he ended up putting a bad review of me online.
On Yelp?
He said I'm a bully.
On Yelp?
Yeah.
Let me tell you something to people out there that are listening. Yelp is BS, okay?
Yeah.
I don't know how people go to Yelp and 60 people that the business paid can write good reviews about it.
Yeah.
And
Yeah.
I have issues with Yelp. So never trust people when it comes to doctors. And most things. What have we become as a society that to go to a good restaurant, you need to go to Yelp?
Well, we
Call
have to all
your
be
friend.
followers,
Yeah, call your friend up. Ask
That's
him.
a whole nother
Yeah,
subject.
but and so Judah, I'm going to be your guinea pigs, okay? And but I trust you already, and I trust you enough that I'm going to go to your office and get an implant. But that's something. What are people out there not doing correctly with finding the right? So
Yeah, and I think dentistry's changed so much. It's easier than ever, even with all to find a team now, because
Right.
we're working as different specialties under one roof, so you can get everything from A to Z done
Right.
under one roof.
It's helpful.
Yeah.
So you get people. So you're obviously, that's one of the things people trying to med shop. What do you call it, Erica? What's the
It's called med seeking.
Med seeking.
But also, I want to just bring up one thing is, recently I have a client who she has to have some surgery, and I think it does involve dental surgery too. She's a couple things wrong, but she's really, really afraid to go because she knows she's going to need some pain meds, and she knows that it was something that she had struggled with in the past, and she doesn't want to, go down that same road again. So instead of someone med seeking, she really wants to take care of her problems, but wants to have an alternative way in which to deal with her pain. And so I think it's wonderful that you provide them other things, whether that's, anti-inflammatories or holistic. And so I think it's wonderful for people to know that
Yeah.
there's other ways in which to deal with pain.
Yeah.
And I think that's so important because I think that's really why, a lot of people don't get things checked on.
So you guys are in New York and LA.
Yes, coast to
Yeah.
coast miles, New York and LA.
So, you guys split time? Or you guys, how does that work? Because do I have to book you a month in advance? Because I got my appointment on November 28th. You gonna be in town then? What's going on?
We're going to be in town.
We can see
Okay.
you on Wednesday before Thanksgiving.
Yeah, that's when I want to get my I want to eat well this year. And
We can see you just for a friendly visit so you can get
oh, that's
to know
true.
us.
That's a great point. Maybe I will come into the office on. Again, I'm scared. It's like one of those things. I'm
Don't procrastinate.
I'm not.
Yeah.
But it's terrifying to even say that. Because in my back of my mind, I still think I could cancel the November 28th date.
Really?
But there's a reason for everything happening. And by the way, give us a call tonight at 888-539-2980. That's 888-539-2980. You're listening to Klean Radio. We're in the studio tonight with the great dentist, the great periodontist, the great, I can't pronounce what it is you do, Dr. Olga. Prosthodontist.
From prosthetics.
From prosthetics.
Not
I get yes, I get that. But you must come across that account.
I do. That's why
Is
it's not a problem.
yeah. Do you just say to people, I'm a dentist?
Yeah. Sometimes
And,
I do. It's just easier this way.
And you're also a nutritionist. How did that happen? How did one lead? What came first?
The
Chicken or the
periodontist
egg?
Yeah.
came first. And I had my own path in life, struggling with certain health problems, stomach issues, and I started studying nutrition at that time. And as I started listening to my patients, I realized they're struggling with nutrition as well. The majority of people don't know exactly, what they're bothered by. Most medical problems are part of nutrition.
Absolutely.
I believe that.
Yeah.
So So I started taking nutritional classes, and I became a certified nutritionist, and I really created my own customized program to incorporate it into healing and treating patients.
Wonderful,
Yeah.
honestly.
It is. I mean, are people, obviously people are, you're probably a very striving practice, but do people, everybody has a different, a different liking of a doctor. My father personally wouldn't like the doctors I see. He wants more of the, people that don't smile. He just tell me what you're going to do it, and I'm done. Me, I like the love. I like to feel like...
You want the attention.
I want the attention, yeah. I want to feel like I'm the most important. I want to know you're only talking to me like that. And how do you get people like that? Do you find that you... Yeah, since you're...
I think your personality attracts certain people. So not every person is going to like every dentist. So we have a certain personality, so we attract certain patients, and we really care about our patients. We really want to understand what their issues are and treat them. And we actually become quite friendly, like good friends with some of our patients, and because we really do care about them.
Well, I'll judge that after I get my work done with you guys, see how good of friends we are.
No, I was going to ask that, because you know what, when you have a doctor, like when you grew up, I'm sure you had the same doctor that your parents knew the doctor. I mean,
Dr. Steiner.
Like like doctors and dentists back in the day, they were part of your family, like an extension of your family. And so I think it's great if you could find somebody like that where you trust them and have a rapport with them and are able to entrust them with certain, kind of secrets or things they're not happy about. Yeah.
And I think what's important for the listeners out there is, like, when you find a dentist, go interview 2-3 of them until you find the one you're comfortable with.
It should be like dating, seeing it.
It is, right.
It should really, but a lot of people don't look at it like that. They look at it like...
it's like finding a therapist or a counselor. I always say, try a couple.
Right. It's like dating. It's okay. I say treat it like a one-night stand. Go in there. If it's great, keep with them. But if it's not, never call them again. And that's okay.
Plenty of fish in the sea.
There are plenty of fish in the sea, right. So, I mean, you're right, though. There is something that's great about the familiar, that type of thing.
Yeah. I mean, I remember growing up with the same doctor, and my mom knew him, my brother had him. So I feel like with the dentist, I think that would be so wonderful if you could find that connection. Yeah.
And one of the things I want to do is I want to bring you, you have a very similar approach. One of the things I love about this radio show, I love about Klean, it's about love. And there are people out there that are listening. There are a couple different ways of people getting sober. I mean, there's many different ways, obviously, but we don't believe in tough love. We don't believe in that sort of like threatening people, because how do you threaten somebody that's destroyed their mouth? And I think that's the approach you guys are sort of taking, or it sounds like is how we treat addiction, is we're going to love you till you get better.
Very similar.
Yeah, we're not going to beat you up. We're not going to,
make you feel bad.
Right, because I had a doctor one time, that I remember when I was younger, and he goes, I had bad knees, and he goes, if you lost weight, it would help. He actually said it in a very caring and nice way. But I had other doctors that said, you're fat. Essentially they said that. And you're of the approach that it's like, how are we going to deal with this?
And I think also because we came from Eastern Europe. I actually was born in Russia too. So I had a lot of dental issues myself. So now when I treat a patient, it's easy for me to imagine myself in this patient's place, because I've gone through a lot of dental treatment myself. So we try to nurture our patients.
And they relate. They both relate, because they're both...
You've been there. You've done that.
Exactly.
Yeah.
You're like the 12 steps of dentistry world.
So many parallels.
Yeah, there really are.
And
you guys are, and it's really cool, because I think one of the things is, I think people that, we were talking about before with the judgment, with the stigma.
Yeah.
We do live in a society of stigma, of, people,
labels and judging. We were just
and jokingly, when Rand, the producer, came in, he was covering his mouth and he did it as a joke. But it's like, I remember when I first met my brother-in-law's father, he's a psychiatrist. The whole night I was scared to talk. Okay? I was like, please, God, don't be judging me, But I'm sure you guys get that a lot. Have you ever been out?
I've been out on a date.
Yeah, I was going to say
that. Ask you that. Is it awkward?
We always get to dating on this show.
Like, I was going to ask you that, but it's actually very funny. I mean, like, do you go out on a date and like the guy...
He's like napkin over his mouth.
He's like covering himself as he laughs.
It's like, what do you do? Oh, you're...
Do you...
Absolutely, I get that, and it's we actually have an oral DNA test right now, which actually we test the saliva for bacteria to see what kind of bad bacteria there's in the mouth, and I laugh about it because I say I have to take it out on my dates and have them swish with it, so I know where I'm going.
I got to take you now. But if you just tuned in, you're listening to Klean Radio. That's Klean with a K. The number here is 888-539-2980. That's 888-539-2980. Want to hear how everybody out there is doing tonight. Patrick, I hope you're doing well. Thanksgiving's coming up, and this is a tough time. This is a really tough time for people all over America right now.
Yeah.
People are hurting financially.
Been a lot of natural disasters.
Yeah, there's tons of
going
stuff going on, and we're doing something really cool at Klean. We're doing something really cool, and there's gonna be a lot of people with a lot of turkey and a lot of food. And to everybody out there that's struggling, just grab on to people right now. And if you're newly sober, just grab on.
Reach out.
Yeah, and there are meetings. There are 12-step meetings going on all the time. They have these 12-step-a-thons, that
all night long.
All night long, all day long. Just stay close.
Yeah. Yeah, and also, if you're starting to feel anxious or nervous about the holidays coming up, really begin to think of ways, and reach out for help, and then have someone help you think of ways in which you could avoid any kind of, negativity, because certainly family members bring that up, and old friends, and you don't want to lose, if you're just newly sober, you don't want to lose that right now.
No, you don't. And we're in the studio tonight with two amazing women, dentist, nutritionist, one I can't pronounce what she does, from coast to coast dentistry. Yeah, prosthetics. What is it? Coast to coast?
Smiles.
Coast to coast smiles. Oh, that's why it was off. He said coast smiles. It's coast to coast smiles.
I like that. That'll be easy
I
to
like that
remember.
too, right? Because you could go from New York you could go from here to any coast and have a good smile. We're talking about bulimia. We're talking about all those things, about drug addiction. How do people, you've had to have that talk, right? Where you say to somebody, but what's really cool is now you're having the reverse talk. You're saying to people that are out there that are sober, that have messed up their teeth, you're saying you can get better.
And in one day, that's the amazing thing.
What do you could do a whole mouth in one day.
Yes, we can. That's what we specialize
So we do
in.
the main
even
procedure in
more.
one day, the main surgical procedure.
Yeah.
So they walk in with broken down teeth, and they could leave the same day with a beautiful smile.
Oh, well, if that's not incentive, I don't know what is. That's pretty good.
I'm pretty amazed by this,
Yeah.
actually. One second.
Thanks.
You could fill 18 cavities in a sitting.
Yes.
Not that I have 18 cavities
Or
anymore.
We could take out all the broken down teeth, let's say all 28 of them,
Yeah.
and put in implants and a full set of teeth.
Okay, can I tell you something? That's actually I'm really happy we're talking about this tonight, because one of my biggest fears, I remember one time I had to I keep on going
It's all
back to
about you.
myself, but I've had issues with my mouth.
Yeah.
And
No,
one
it's
time I
good.
had to get a root canal, and I used to hate what they stuck in after that thing, that antibiotic for a week, and it smelled like spice or something. You guys know what I'm talking
yes,
about?
eugenol.
Yeah.
That was like prehistoric days.
Yeah, this was
when
like
you-
6 years ago. And so I found the dentist the root canal guy that right across the street was the dentist. And so I went from one to the next so they could fill it in right away. But you're saying, and I think people do have that fear, because dentistry, when you have these issues, it takes a while.
Not anymore.
Not
Right,
with them.
right, not with you guys.
Yeah.
And I think it's really important. And I think for addicts especially, my biggest fear is the process.
Yeah.
I'm going to have to do this for a month.
want instant
Yeah.
results.
I want instant results.
Yeah.
I want to be told today you're getting it done. one time, right?
Instant gratification.
I
Isn't
want-
that what most people
Right.
want?
So I'm sitting with the dentistry of instant gratification.
Yes, we love it.
I love you guys. I wish I had
Love
known
you
about you
too.
for the past year. I'm not joking.
No,
I'm dead
really. I know.
serious.
I've jumped around too.
Yeah. It's really hard. I know you've jumped around.
that's
But no, but
That's the biggest complaint about to run from one office to another.
Oh, to get the X-rays and have the X-rays sent to the.
because I've stopped in the middle. I've gotten the stuff done, but I get so terrified in the middle that I
Yes.
stopped getting, that I stopped going the rest of the way.
That's
Yeah.
very common for
Yeah.
people to just drop out.
Yeah.
They get frustrated because they go to one person, they hear one thing, then they go to another dentist, they hear another thing, and feels like there's no communication. That's why we work together.
I think it's more than frustration. I think it's being terrified.
Yeah.
Let's be real. Somebody is going into your mouth. There are three, it's
But they want some closure too.
Yeah.
Like they want to know, Okay,
Yeah.
like for what you ladies are saying is that you will give them kind of the finale. They could envision it, and they don't have to wait 2 weeks in order to come back. I mean, you do it all in a day if they want to, and so that's what's nice.
Yeah, that is. I mean, I used to have my dentist have a stopwatch essentially and tell me how many seconds more
only
he would
an hour
be drilling.
For you. Yeah,
I mean, it was just terrifying.
Yeah,
and the reason I'm sharing this stuff and I'm doing this joking way, I know there are a lot of people out there that I hope, that I'm not the only one that thinks like this, but I'm guessing there are a lot of people like me.
I think almost everyone.
Yeah, and they're just really
me.
and they're really scared to say this stuff out loud. You guys are terrifying to them, but I'm here to tell you, the women at Coast to Coast Smiles are not terrifying.
No, and they will not judge you.
Right?
They won't judge you.
They're saying they're not going to judge you, and I'm going to tell you guys what, I just might be their guinea pig, and of the listeners out there listening.
Welcome you.
Yes.
I have no fear, so I'd do it too.
Yes, but you don't. You're lucky you don't need to get what I have to get, and yeah.
True.
Yeah, because really the mouth is a window into somebody's health.
Yeah.
And if your mouth is clean, then their whole body could be cleaner.
Right. So tell me really quick, what that bacteria swab, what are you looking for these days? What is the newest? Is that
So it's amazing. Now with the saliva, we could test so many things. One of the tests we have is a swish, which you spit into a test tube. We send it to the lab, and we could find which kind of bacteria is causing the periodontal disease.
Oh, okay.
Yeah, so we could treat it that way. It's more specific.
It's not like,
Are you able to detect anything else that's malfunctioning with the health or with your health overall?
Yes, we have other tests, and actually there's a huge branch at UCLA where I actually still teach for salivary testing. And they're making these devices where you put a drop of saliva and they could test whether you have a cancer or diabetes or different things. Yeah.
Let's just say if I ever go to dinner with you, I'm keeping my cup. I've seen enough identification discovery. If I see you anywhere, a swab near me. Let's go to Patrick. Patrick from Austin, welcome back.
Hi, Patrick.
Hey, you guys, how are you?
Good. How are you, Patrick?
I'm doing pretty good.
Yeah.
What's cooking? Just so you know, Patrick is a regular caller, and according to Patrick, our video guy, today you should have 36 days sober.
No, right. I didn't know that.
Yeah, Patrick's been doing the counting
He
for
hasn't been
you,
counting.
Patrick.
Yeah.
Awesome.
So basically, about 36 days ago, Patrick called in and had his alarm clock set to the show, threw a 12-pack out, and he's been sober since.
And calling in ever since.
Calling in and keeping up and
checking in.
Checking in.
Amazing.
What's up with you, Patrick? How you doing this week?
I'm doing pretty good. I think today was actually the first day where I had a little struggle.
Okay.
And it's kind of scary. Didn't really have anything to fall back on, which is kind of scary.
How are the holidays? Are you getting anxious because the holidays are coming up, or do you have a plan?
Well, I'm going to be with my girlfriend all weekend with her family. So.
Okay, good. Are they safe? Are they understanding? And
it's the first time I'm meeting them. So.
Oh,
wow.
wow.
So that could be very stressful meeting. How long have you guys been dating?
2 months.
Okay. And you see, but Patrick, this is what we were talking about, and I'm not, I never try to put pressure on you, but you said something where you said you didn't have anything to fall back on today. And maybe one of those things to fall back on is maybe even if you started going to a meeting every once in a while.
Well, that's exactly what I was thinking today. It was, usually, I don't know, it was weird. It was the first day that I had a little urge to go have a few drinks, and alcohol is not my thing, and but it was just weird how I wanted to have a few drinks because I can justify it a lot easier. But when it came down to it, it was like, well, crap. Now what do I do? It was
right.
You played the tape in your head.
I didn't have a meeting to go to. Yeah. It was like, wow, I kind of missed that.
Right, the fellowship.
Right.
And sometimes, Patrick, that's lost as the fellowship a little bit. It's okay to go to 12-step meetings. If for nothing alone, you went to say hi to people.
And a community. It's also nice to have that, yeah.
And if you decide to get into the 12 steps, you do. But just to have that group and that bond, Patrick.
Right.
Yeah.
Well, I do miss it. I've always been all for it. And, it was, today it was actually funny because when I was out of the store grocery shopping, and one of my friends that I met in AA actually stopped by my house to see how I was doing and got to know my girlfriend when I was gone.
Oh, wow.
And so it was kind of I don't believe that's a coincidence by any means.
No, there are no coincidences, Patrick.
Right. And I guess I'm getting to the point where I do miss it, even if it's just for the fellowship.
Yeah.
I do miss it.
So I'll tell you
Go
what,
back.
Patrick. Let's make a deal, okay? Let's not make a deal. Let's just make an agreement. Because a deal, I'm probably going to lose.
Yeah.
Let's just be real. I lose most of them. Patrick, I want you to make a meeting this week.
Yeah, I think I'm going to go tomorrow night. I used to go to the Mondays around here, and I enjoyed them.
Okay, I'll tell you what. I want you to go and Facebook me afterwards, okay?
Okay.
And just tell me how it went.
And just enjoy
Yeah.
it. And just enjoy it and
Yeah.
you know, try to meet people, be
Yeah.
open-minded, open-hearted.
And get a few numbers, too. I mean, get that guy's number today, your friend from AA. You know, because let's say you do get a little stressful. Families are stressful. I mean, I one time heard somebody say families know how to push the triggers because they put them there. You know, and
He's meeting his girlfriend's
he's
family
meeting his
the first
I know,
time. It's
I
a
know.
big deal.
They make movies about what you're about to do,
Yeah.
Patrick. And it's going to be. What was your drug again? It was meth.
Correct.
And so we're in the studio tonight with the two amazing dentists from coast to coast. How are your teeth doing, Patrick?
They are beautiful.
Oh, really?
Nice.
Did you get them?
I've been pretty lucky out of all the years of smoking crack. I've never had a cavity, never had anything.
But did you know other people that were smoking crack, did they have a lot of issues with their teeth?
I didn't know very many who didn't have issues.
Right. That's what I was saying. All I see is
Yeah.
people with issues, yeah.
And so Patrick, just, you know, we're talking about something very interesting. Other than just going to the dentist, I hope you're, you know, it's very important, you know, that when you do get sober, to go get your health checked out.
Yeah, well, I got insurance luckily through my job, and I use it.
That's great.
Okay, that's great, Patrick.
And don't forget to brush and floss.
Yeah, don't forget to.
I love it. Get that in there.
Yeah, and I mean, it's really cool, Patrick. I'm really happy you called, and I'm really, you know, I love the fact that, and we were talking about this before, is that, you know, and the same thing with you guys. From Coast to Coast Dentistry, it's that we never push Patrick, you know, and to all the people out there that are listening, I've never met Patrick a day in my life. I hope to meet him one day, but we never pushed him. He would call the show when he was getting drunk. And we never pushed him to get sober. We never said to him, "Hey, you can't call in," you know. And we're not about that,
yeah.
you know. And
But that's how you build trust.
but that's
You
right.
trust,
And
you
it sounds
know.
like you guys do the same thing. You know, it's like you're not, you know, nobody's going to walk into your office and they're going to be, you know, they're going to feel bad.
Absolutely, and you have to build that intimacy and trust with your dentist because we're really looking inside somebody's body, right? The mouth is the opening. So find a dentist that you could trust. Very important.
Yeah, and find people you could trust. Patrick, it sounds like you have a few of them good that are out there.
Yeah.
And it's time to give them a call. You know, it's like stop being that bull. You know,
Right.
and
Don't be
stop.
stubborn.
Yeah, stop being. I know. Stop being that bull. Stop being stubborn. I'm thinking about the Taurus sign being. You know.
I get it.
Yeah.
Remember, I'm the whisperer. I
Yeah,
understand
you're
what
the
saying.
energy whisperer. I'm in the studio, Patrick, tonight with a lot of whisperers.
A lot of women.
Yeah, a lot of women. You know, it's really funny. I'm just gonna with Patrick still on the line. This guy outside, the guy that you saw, I don't know if you're one of the people at the radio station. I always call him the man with the golden pipes, and he goes, "Hey, it's Mr. Bond walking in," because he's like, you always have, you know, he's like, you always have these Bond girls walking into the studio. I'm like, why are our guests here already? And he's like, no, I'm just talking about the past. And I was like, wait till you see it tonight. and Patrick, I want to wish you an amazing Thanksgiving.
Patrick,
okay?
I'm so proud of you. You've been doing such a wonderful job
Really,
at taking care of yourself.
Have fun this Thanksgiving.
Enjoy yourself.
Yeah.
Yeah, I will.
Okay, Patrick, I'll talk to you next week.
Okay, sounds good.
Have a great night.
Bye.
If you just tuned in, you're listening to Klean Radio. That's Klean with a K. We're running out of time. You wanted to say something. I noticed you just wanted to say something. It's private.
No, actually, I'll tell you what
Are
it
you
is.
drawing pictures of my teeth? That you guys are going to do to me when I come and see you?
We actually have a friend who
Yes.
has a problem with addiction.
Yes.
Okay.
She's an alcoholic. So we actually try to help her, but we're kind of at the end of our road because we don't know what to do.
Right. And
So-
do you know what she's using?
Alcohol. Yeah, just alcohol. And she's living on the streets right now. She's actually a dentist.
Oh, wow. And she's homeless.
And she
Yeah.
doesn't want help?
No.
She doesn't
We
want
tried.
help.
Yeah, no, she doesn't. She doesn't want
Where is she?
to. In LA.
Do you know where on the street she is?
No.
No.
I'll tell you what.
Wow.
I'm going to give you my phone number. If you ever find her, you give us a call and we'll try to figure something out.
I'll
Thank
go
you.
talk to her.
We'll be like, you know,
Great.
we'll be the, you know,
Yeah.
Erica will whisper, I'll talk really loud.
Yeah.
It's horrible when you see that
Yeah.
somebody's going through it. And it's amazing that we live in a time, it's really amazing that people say just alcohol. And I say the same thing, and I'm one of those rare breeds. I'm the dinosaur of my day that I just drank. It just drank. It's one of the few things
Just
that could
drank,
kill you
yeah.
as you're detoxing from
It's
it.
the worst. It's the worst.
It's the oldest drug in the world, and
It's poison.
yeah, my heart goes out to you. And there,
Thank
you know
you.
what you're going through right now. So many people out there right now that are listening are going through this. You know, that are going through, alcoholism, addiction, and don't know where to call, don't know what to do. And
Even for them to ask us, it
Yeah.
was a little bit hard for
Yeah.
them. So I could tell.
I'm honored.
Yeah.
I'm-
For 3 years she's been struggling with this, and this is at the lowest we've seen her. Really,
Wow, yeah.
you know.
And, and it's amazing because it's like it's not just for it doesn't care who it affects, addiction and
Dentists,
yeah,
businessmen,
you could be from
students,
highs
it
to
doesn't matter.
lows. It just doesn't.
All walks of life.
Alcoholics Anonymous was founded by a broke down proctologist, one of the best in America, and basically the guy that created insider trading. And they two geniuses of their industry, and it just doesn't matter. And it's hard. It must be terrifically hard for you guys because
Very hard.
intellect doesn't work with addiction and alcoholism.
Right, right.
Nothing. It's there. There's no rationale.
And it seems like there's been a lot
No.
of negative consequences
Yeah.
for her. And so you intellectually are like, how she's lost everything. Like, how come
Yeah.
she doesn't want to get help? But see, it's so much more than that. It's such a beast.
Yeah.
Right?
Yeah, she's lost her practice already. She's about to lose her 2.5-year-old daughter,
Yeah. See.
and she just
It's
can't
unreal,
stop. Yeah.
And it's the saddest thing is she represents like 99 people out there tonight that are going through the same thing. I mean, it's just insane. And we're running out of time. I loved having you guys in the studio.
Thank you guys for coming.
It's great
you guys
to
are
be
from
here. Thank
Coast
you.
to Coast Dentistry.
Coast to Coast
Smiles.
Smiles.
God. Okay, I'm going to say this again. Coast to Coast Smiles with Dr. Olga and Dr. Sanda. How do people get in touch with you?
Email us, coasttocoastsmiles.com.
And is that the website too?
Yes.
Yeah.
And I'm gonna go see these guys. Hopefully, I'll get an appointment for this Wednesday. If you don't see me there, it's just because I got scared. But Erica will then tell me to man up and go.
Yes.
Yeah, come on
But
over.
you guys are amazing.
in.
Thank
I
you.
just want to
Yeah.
thank everybody in the studio tonight from Coast to Coast Smiles. I got it right that time. I want to thank my co-host, the
Thank
Energy
you.
Whisperer, Erica
you.
Spiegelman, and you guys are the Tooth Whisperers.
Yay.
From Coast to Coast Smiles. We had a great show tonight. Everybody out there have an amazing, awesome
Have a
Thanksgiving.
good night. Happy holidays.
Yeah, discussion continues at cleanradio.com.
Are you struggling with an addiction that's ruining your life? Want to have a confidential conversation with a professional that will immediately assist you? Do you suspect a loved one is abusing drugs and would like a free drug testing kit and consultation? Klean Treatment Center is standing by right now to help those with addictions and the people who care about them. Call 888-601-6040. That's 888-601-6040. Or go to Klean Treatment Center, that's clean with a K, cleantreatmentcenter.com.